Nervous, so bear with me. How many people here have health insurance, whether it's through your work or on your own? Let's show of hands. Okay, how many of you that don't have health insurance are not getting it because either it's too expensive or you think that you probably won't need it because you're, for the most part, a very healthy individual? You don't have to raise your hands, just think about that one for a second. Okay, now, like a recent Gallup poll, according to this, at least, there's 1 in every 6 American adults that don't have health insurance today. For those very reasons, it's very expensive, and for a very long time, health insurance companies have gone unchecked. They're raising premiums to cover costs that they're not even actually putting all this money into. And recently, actually a couple of days ago, thanks to what we call Obamacare in the media, I got a rebate on my premium because my health insurance company is not using all of that money to pay for my doctor's bills. And I think that's really disturbing because I'm paying, hundreds of dollars a month in order for them to do that. Of the 350,000 that were interviewed for this Gallup poll, 16.2% said no, they don't have health insurance for various reasons. That's kind of scary. I mean, if you get into a car accident, the bills that you could pay the hospital alone are astronomical. The ER, I know a lot of people these days are using the ER as kind of like their go-to source for doctors, because they wait till the last minute instead of going to the doctor when they should. Like, say they have the flu and they're thinking, oh, it's just the flu, I'll stay home, I'll get bed rest, I'll have fluids, or get fluids, I'll get Theraflu, all that stuff. And then it turns into something far more serious, and all of a sudden you're in the ambulance on the way to the hospital, and then you get that bill once you get out, like a couple months later, and it's in the hundreds of thousands, including the separate bill you have to pay the ambulance and all the diagnostic scans, the individual doctors that you've seen while you're there. It gets really pricey. So it's kind of a pro and a con to have health insurance. I mean, you're spending so much more money to have those bills reduced for you because the insurance companies will cover it, but you're also not being covered entirely when you do pay for that. Let's see. The government does have health plans or health ways of helping out people who can't afford health insurance through like Medicaid, Medicare. Obviously Medicare is limited to those, the elderly and the disabled. Medicaid's limited to those who have low income, and it's set at a certain cap. They help those with lots of children as well that can't afford health insurance. But again, that's got a cap, so not everybody falls into that. So we've got the people who can't afford health insurance and the people who are covered under Medicaid, and the rest of us kind of fall in between, and that's the middle class. I mean, we kind of get screwed a lot, unfortunately. With the health reform, with the health reform, kind of seeks to bridge the gap. And does anybody know what Obamacare really is called? Like the actual name? Right, by a show of hands, do you guys know what it is? No? It's called the Patient Protection and Affordable Care Act. Basically, it's trying to bridge that gap. Of course, there's going to be a lot of pros and cons. There's a lot of opposition to it. A lot of people think that there's this push towards socialism and that our freedoms are now at stake because we're being forced to carry health insurance. I want to give you a little bit more information on that. Of course, these are only a few titles covered under the health insurance bill. I strongly urge everybody here, now that it is a law and it has been ruled constitutional, to go and research this. See what all exactly you are now, for lack of a better term, being forced to do. Okay, under Title I, this reduces premium costs for many American workers. For example, I pay $219.70. It's my premium every month, and it is expensive, and as a college student, I cry every time I pay it. But it's nice because instead of paying $100 at my primary care physician, I'm paying $35 or $25, and that's my copay. This reform seeks to reduce those premium costs by using, obviously, taxpayers' money. That's kind of a con to it because a lot of people are thinking, I don't want to pay for these premium costs, like these reductions. I mean, I don't want health insurance. I don't think I need it. Why am I paying for all these people to basically pay less for their health insurance? This title also bans health insurance companies from either blocking coverage for people who have pre-existing conditions, blocking the coverage of that pre-existing condition, or charging them more on their premium to cover that. I mean, that includes anything from hepatitis to say that you had cancer at one point, now you're more at risk for cancer, and the health insurance company doesn't want to cover that because you're a liability and you're going to cost them, you know, hundreds of thousands in the future, and they don't want to cover that, and that's unfortunate. I mean, Blue Cross Blue Shield does that every day. I'm currently not covered for my pre-existing condition because they find that all the procedures possibly in the future is going to cost them so much money, which I think is ridiculous. Now, if you're also blocked under your current health insurance plan, you now have the ability to appeal your exclusionary clause. Like if your insurance company is telling you I'm not going to cover you, now you have, it's a really long drawn out process. You have to write actually a handwritten letter to appeal it now, but you do have the ability to do that. They can't just tell you, no, we're not going to cover that, and you have no say in that. Now you can write a letter and you can start the process. Again, it's very long and drawn out. That's another con, unfortunately. Now under Title II, this extends Medicaid. It brings the cap up a little bit more for those, I don't know exactly what the cap is for Medicaid. I didn't research that far into it. But say that you make $20,000 a year, that's the cap. If you make that much and you have, say, 2 kids, it'll cover you under Medicaid. It covers you, your kids under CHIP, and it covers you and your expenses. Right, so you can go to a clinic and get a flu shot, finally, for the first time, and those for your kids so that they don't get sick. Since we all know kids are very susceptible to getting sick. They all sneeze in their hands, they touch each other, they run around. I mean, they're putting their hands in nasty, dirty places, and then they want to come hug you and kiss you, and you're just like, I love you, but let's wash your hands first. And you know, kids don't want to wash their hands. They run in and out of that bathroom as quick as you can say, no, you don't know what you just touched. This also gives the states flexibility to adopt innovative strategies to improve the care and coordination for these services, for Medicare and Medicaid. It's allowing the states basically to decide whether or not they want to raise the cap, or at least how much they want to raise the cap. I mean, they have to raise the cap, that's part of it, but they get to decide how much they want to raise it, who they want to cover, who all they want to include now under this actual thing, Medicaid service. And also, I'm not sure exactly how true this is, but as what I read under this website that actually is designed by the government to help us more understand this, it saves taxpayer money by reducing prescription costs. I know all of you have gotten sick at one point in time or another, and the prescription for your antibiotics is ridiculously priced. Like, sometimes you pay $60 to $100 for, I don't know, 15 pills. And half the time you don't even want to take half of those because they make you sick. And they can almost make you feel worse taking them than being sick in the first place. There was actually a little flip of a cartoon. It was like a guy at a drugstore, and there was a drug for colds, flus, coughs, and then drugs for side effects of medications, because often they're worse than the actual medication. All right, under Title III, Medicare is protected and preserved as a commitment to America's seniors. Now, I know we're all going to get older one day, that's inevitable, and your body starts slowing down, and you no longer can work, and now you can't afford your own health insurance. And here comes Medicare. It covers everything you need, at least for the most part, unless you, it's like an extenuating circumstance, say you can't get cancer, and obviously Medicare is not going to cover everything. It'll cover like the diagnostic procedures. Beyond that, the bills are pretty much yours. But it extends Medicare a little bit, it protects it, preserves it. It takes important steps to make sure that the commitment to Medicare is going to be available for seniors in the future, because we all know that baby boomers are getting older and they're taking up a lot of our funds. You know, Social Security, they think it's going to run out, and same with Medicare. They're basically ensuring that this isn't going to happen. And finally, they make sure that the quality care of seniors drives all their decisions. So they are making sure that it isn't a congressman who's deciding all of these things. It is doctors, healthcare providers, it's nurses out there. They're deciding what all it's going to cover and how much they're going to cover, which I think is nice because they're a little more close to the issue than a congressman is, sitting up in Washington making our decisions for us. And Title IV, they're basically promoting the prevention of chronic diseases. So they're making more available the diagnostic procedures to to diagnose these things, but they're also putting out more preventative issues, or more preventative things like mammograms for women on, I guess, a yearly basis past a certain age to make sure you're not getting breast cancer. They're promoting other screenings for other different kinds of diseases that plague our society now, like Alzheimer's, unfortunately AIDS, things like that are on the rise. Now, things included under this title include oral health care prevention activities, incentives for prevention of chronic diseases in Medicaid, and coverage for tobacco cessation programs for pregnant women, which I think is awesome, because when you're pregnant and you smoke 2 packs a day, it's really difficult to just quit cold turkey. But you know that it's healthier for your baby, as statistics and studies have shown. And finally, under Title V, this is probably, I think, the coolest part of it. Say you want to be a nurse or a doctor, and you don't have the money to do so, so you kind of let that dream fall by the wayside, or you just drive ahead and you're getting yourself into all these debts and astronomical, I mean, like hundreds of thousands of dollars. Well, under this reform, they're funding scholarships and loan repayment programs to increase the number of primary care physicians, nurses, physician's assistants, etc., to get through school and get out there in the workforce, because let's face it, the older generation is aging and they're going into retirement, so it is a real possibility that we will have a severe shortage of doctors, nurses, etc. in the near future, and that's frightening because we need care too. And the older generation is going to need care when they get into that geriatric phase, when they're in the nursing homes and when they're, you know, at home and they can't take care of themselves anymore, but they don't want to go to the nursing homes, you know, and I personally wouldn't either. I mean, I want to die in my own bed. It's kind of depressing when your family doesn't see you in the nursing homes. It also helps to expand critical and timely access to care by funding the expansion, construction, and operation of community health centers throughout the United States. I thought that was a pretty cool thing as well. Again, these are not all the titles included under the health reform. I strongly urge you guys to go to, I think it's called healthreformlaw.gov, and research it. It has a summary of every title in there, and it gives you an idea of what exactly this is going to have us do as American citizens. You're not going to like everything that's under there. It's not all pro. There are definitely cons. That's my next part of the speech. There are consequences to us and to the health insurance companies. Obviously, the government is now making them pay for a whole lot more, and they don't like it because they can't afford it. And so, you know, like for example, the age that children can still be covered by their parents is now bumped up to 26, which is kind of awesome, but not. I mean, it's going to be a lot more on the parents, definitely. You know, their kids really don't want to get out of the house, and they're like, hey, put a little more money my way. To mom, dad, I don't want to get out on my own yet. And the health insurance companies are going, pay for all this. So the costs are rising for them. As a result, they're rising for us as well. Studies show that within the first 10 years of the bill's implementation, it's going to cost as much as $2.7 trillion to the American taxpayer. That's a lot of money, and I work really hard for my money personally. I know you guys all as well. It's kind of scary, and it's kind of like, I don't want to let go of that. I'm just going to stick it under my bed, and we're not going to say I made it. Fees, taxes, everything is going to increase. You guys heard, of course, that they're charging a fee now if you don't have health insurance. That's kind of frightening as well. It's a lot of the reason why people are thinking it's more towards a socialist movement instead of the democratic freedoms that we have. Let's see. There are benefits to the program, though. Under the, as like I've stated before, there are a lot of cons, pros. People are for it, against it. It's brings me to my next point. It's surging. Or rather spurring the political movement going on right now. Obviously, we're in an election year, so each campaign is taking a bandstand on it. Mitt Romney is very much against it. I found it rather entertaining. He states consistently that he wants to repeal this reform all the time, and for the most part, you know, a lot of Americans are like, you know, hell yeah, excuse my language, but hell yeah, like, repeal that thing. We don't want to pay those taxes. However, he was recently recorded at an NAACP convention where he stated that. He was very adamant about it, and the instant he said it, half the crowd booed him almost off the stage. I guess were more for the pros in that area, and he kind of stuck his foot in his mouth. But I mean, there are both sides. There are a lot of Democrats that are really for it. There are a lot of Republicans that are really against it, and there's those that are in between that really don't know how they feel about it because they don't know what all it entitles, or what all entails, basically. There's a lot of public opinion. There's both sides of that as well. A lot of Americans are really, really upset. They don't want to be forced to have health insurance. They don't want to pay all these taxes and fees that are going to happen. Then of course, there's people like me who it affects directly, like that have pre-existing conditions that are going to schools for nursing or to be a physician, and now it's becoming more available to graduate. To graduate on time. They were talking about that a couple days ago. You can actually graduate and not have this astronomical debt. I can actually be covered under my health insurance completely, and that's exciting. I know I'm gonna have to pay more, but I think honestly that in the long run that's such a small con, at least to me. That's my personal opinion. Again, everybody feels differently about it. It's a very controversial issue. I just wanted to bring to light what it all entails, or at least a little bit of what it entails. Again, strongly urge you guys, please read about it. It is a bill now. That brings me to my final point. It has been ruled constitutional. A lot of people are outraged by this. A lot of people don't know how to feel about it. Chief Justice Roberts pretty much threw it into the political forefront, and they ruled it constitutional based on that it is a tax, and that constitutionally speaking, our government does have a right to tax us as American citizens. Now, beyond that, I'm not entirely certain how he managed to just make it constitutional based on that, but he's thrown it into the political forum now, and based on who you vote for in the future, it's it'll either remain a bill or they'll repeal it, and it'll be a long, drawn-out process, and all in the media again. So, basically, in conclusion, it is a bill.
Thank you.
Research it.